Welcome and thank you for attending this course. In this video, you're going to learn basic first aid during on-field injuries as a coach. So let's get started. First aid, on-the-field management for coaches by Megan Matson. Before practice, be proactive. This is to prevent injuries and potential life-threatening situations. This can be accomplished by checking your playing fields before games and practices, knowing where your closest automatic external defibrillator or AED is located in case of an emergency, knowing your athletes and if they have any predisposed medical conditions, having a fully stocked medical kit, an updated emergency action plan, and knowing the weather before you go. What are some potential dangers within a playing field? Holes in the field. This can lead to knee and ankle injuries. Sprinkler heads. Tripping over these or landing on them can lead to lacerations and orthopedic injuries. Finding glass or debris in the field. This can lead to lacerations. All of these injuries can be prevented by being proactive. So know your athletes. Know if any of your athletes have any predisposed medical conditions, such as asthma, which requires an inhaler, allergies, which may or may not require an EpiPen. Quick tip. Before each practice and game, have the athlete show you where they keep their inhaler or EpiPen. This way, during an emergency, you already know where to look and are ready to act. Now that we have reviewed quick checks of the field, weather, and predisposed medical conditions of your athletes, let's talk about supplies that may help you. So let me ask, what items do you currently have in your medical kit? Below is a rather large list. What I hoped you had mentioned was gloves, Band-Aids, gauze, cold compression, ointment, CPR mask, ACE bandage, and emergency kit. Having all these items is for sure an A+ medical kit. I know it may be challenging to get the items mentioned previously, but if you're able to go above and beyond, these are some other items that I would recommend. Now that you've been proactive and have a fully stocked medical kit, let's talk about management. You are looking at the universal sign of an injured athlete. Ask yourself, if this happened during one of your game or practice, would you know what to do? Well, hopefully by the end of this presentation, you will know the basic first aid to assist in an on-field injury. So during an injury, ask yourself, is the scene safe? Is the athlete not breathing? Are there any deformities or open wounds? If any of the above answers are true, call 911 immediately. So let's talk about 911 etiquette. Calling 911. Be sure to state your name, the exact location, a brief overview of the situation, and stay on the line until they tell you to hang up. Remember to remain calm and answer all questions to the best of your ability. I can't stress enough. Do not hang up until they tell you to hang up. Now you can fully attend to the injured athlete. First up, blood control. If an athlete is bleeding, be sure to wear gloves, apply gauze along with pressure to the wound, elevate and apply ice. Your goal is to stop the bleeding. Sometimes when dealing with a traumatic event, the athlete or person being treated can go into shock. When treating shock, if there is no lower leg injury, elevate their legs above their heart, keep the person comfortable and calm, and move the neck to one side if able to. Splinting a fracture or dislocation. Now only do this if you're feeling comfortable. It's okay to leave the athlete as you found them while waiting for EMS, but continue to assess the athlete. Even if you are just monitoring the athlete until EMS arrives, I do believe knowing this information is important. Number 1, do not reposition the injured area. Leave it how you found it. Stabilize above and below the injured area. Take your time and once completed, check for circulation. I'm going to go over a very quick and easy check for circulation. You could always ask the athlete if it's too tight, but another quick check is go ahead and look at the end of your fingertip. Grab your 2 fingers just as the picture shows and squeeze your fingernail and release. You'll see it go from white to red rather quickly. This means you have good blood flow throughout the limb. We also call this capillary refill. After learning some very basic first aid techniques, it's important to know a general rule of thumb for orthopedic injuries. RICE. Rest, ice, compression, elevation. Rest the injured area. Ice in the rotation of 20 minutes on and 20 minutes off. compression during the day but not at night, and elevate if possible while keeping the injured area above the heart to keep swelling down. As a coach, it is your job to teach the fundamentals of sports to your athletes. But with any form of physical activity, injury is sure to follow. Your main role during an injury is to recognize and refer. Recognize that the athlete has been injured and refer out. So be sure to trust your instincts, be prepared, and remain calm. Good luck during your sports season, and let's keep our athletes safe. Thank you. If you have any further questions, please do not hesitate to reach out to me. My email is megan.matson@rothmanortho.com.